just like me. We love shaking it up. His marketing is awesome. Your newsletters, it's insane how many resources he shares. I tell him he's stupid for doing that because it's just so much good stuff, new, fresh content. So highly recommend signing up for Podiatry Mastery.
Yeah, Podiatry Practice Mastery. That's where I play. Thank
Yay,
you.
Dawn.
Thanks, Nicole. So I'm going to kind of give you a way of taking what Dr. Friels has done, and you can just make your own practice protocols. And so it's really as easy as adding another slide to a PowerPoint presentation. It's not really that complex. But everything I learned here was from the academy. Back in the day, I started coming here as a student, and they were talking about canned spiels. Remember that, where you had to learn the canned spiel? And then they were talking about, I remember these big workbooks that they made us for protocols. Okay, so this isn't anything different than that. I just put it in a different format, and I just want to teach you guys, you might want to consider doing it this way, into a treatment plan. And then more importantly, the fun part for me is taking it and making it technological, so it's easy to edit in like Google Slides and Google Docs, and it's really easy to do every day. So let me just, so I do own this Podiatry Practice Mastery where I help people with doing this types of stuff, these types of things. So why do you need protocols? I don't know if everyone has these protocols, but we all kind of have protocols in our head. You kind of know what you're going to do the first plantar fasciitis visit, second plantar fasciitis visit. The struggle comes in when you start to get like shockwave and then like integrating that, or you're going to get Swift. And just a quick experience, I got Swift. I just added one more slide to my wart presentation, and now I had the wart with Swift presentation. It just took one extra slide, and now everyone gets Swift instead of getting Cantharidin. It's just one extra slide and one extra word in my Google Doc, and I'll show you how to do that. It's easy to add new elements. That's the thing. When you get a new thing like an ultrasound or something new, a lot of us have a hard time adding that to our protocols because, frankly, you have to remember it. You have to remember it, and we have too many other things to remember. So I don't like to have to remember. I like it to remind me. It's going to simplify your explanation of complex conditions, and like Dr. Friel was talking about, it's going to improve your per visit value. That's what it comes down to. So I've been here for a lot of the hours today. I've done that same thing where I only see routine. I haven't cut it totally out, but I do routine from 8 until 11:30, double booked, just on Fridays. And that's really worked. But what's the reason? It's the reason because it opens up you for new patients. And it's the new patients that you can do these things for. So how do you set up protocols as a new doctor? Because this is for new doctors, but I can see there's a lot of people here that aren't new. You shadow current doctors that are with you. You shadow people that are here. My best advice would be, if you don't have anyone that really impresses you, call one of us and say, hey, could I come just hang out with you for a day? Everyone that's lectured to you here, we would love to have you hang out for a day. And you would learn more in that one day than you would at any other conference, and then you would just write down how we do things. That's what I would recommend. I would recommend developing a visit 1, visit 2 for each diagnosis. So this is what you do the first visit, the same way every single time. This is what you do the second visit. Now, even though you say, oh, it depends, it really doesn't depend. It might be a little bit variable, but you have to have that for everything that you do. And I put these all into my treatment sheets. So if you go to patientpresentations.com, you can get my treatment sheets, and they're all right there. Start with the most common conditions, such as plantar fasciitis, Achilles tendonitis, nail fungus, bunions, neuromas, and I'm going to actually go through and show how I do that. Then how do you develop it? Well, develop a standard process. In the beginning, my slides were like 20 slides long, and I didn't have time to go through it with the patient. So that was the mistake I made. Now my slides only have these things. They have imaging, explanation based on diagnosis, and then a way of explaining it. So for example, for my plantar fasciitis presentation, which is basically Google, I don't know, I have a computer in every treatment room. And so on the top bar, on my whatever the folders bar is, I have a link to something called a link tree, which is basically a whole bunch of links. And then each of those links, it'll pull up a PowerPoint Google slide in full slide mode. And then I can use my cursor just to go between slide and slide. That's what I do all day long. I've tried other things. I've tried recording the video and giving them an iPad to watch. That didn't work so well. I tried doing the whole presentation of 20 slides and I got really behind. So now I only do 3 or 4 slides, and then I send them a recording of it afterwards. And I give them, and that recording is on a blog post with everything written down as well, kind of like a transcript type of thing. But you can follow all mine stuff and you can just copy it. I go over x-rays, ultrasound, gait evaluation, physical exam, your script, your patient presentation, developing treatment sheets. So first rendition was the slides. And then from the slides, I'm like, I can't give everyone the slides. That's why I wanted to put it all into one-page Google Doc. I call it a treatment sheet. And that's what I give to my patients. And then it goes into something else, like these things. And I think a dynamic demonstration is important for whatever you're doing. I got that from the chiropractors. But for example, when you hold the foot and you just, you invert and evert the foot, and then you hold the heel, the foot doesn't move. They really like it when you do that. So I do that for every single patient, and I explain what an orthotic does. It's not an arch support. It actually stabilizes your heel with a deep heel cup. And that makes sense. So we have these dynamic demonstrations. You have them stand up on one foot and you realize their balance is off. So I have them, do the gait exam. Sometimes I'll take their phone and I'll record their gait and they can see that they're pronating. I do these dynamic demonstrations quite a bit. X-rays, you show there's like everything's collapsed down. You show them things like that. So I have a dynamic demonstration. Practice, I recommend recording yourself, which no one I know is ever going to do that, but I would recommend you doing that, to actually taking it and listening to yourself, because it really humbles you, and then you're going to improve. So this is an example of one of the patient presentations that I recently modified. So if you look, and you know how I did this? I made them black and white, and I paid someone in $5 or $15 to design it for me, because I'm not very good at the design. And hence you can see all my slides are black and yellow. I don't like to design, I'm not, but I paid someone on Fiverr to do it. The question I always get, so warts, so if you look up on the upper right-hand corner, that little thing that says treatment sheet, that's my treatment sheet. So I can print that out, and that's what I actually give to the patient when they leave. And that treatment sheet has a QR code that goes to the website. So everything is kind of right there. So I have some high-text ways of doing it, where I can text them, but I've realized low-tech a lot of times for our patients is better. Everyone always asks me, is this a wart or a callus? That's why I put that in there. Then you get, why did I get it? Everyone asks me that. So you take the common questions and you put them in the presentation. And if you get a question that's not in the presentation, you add it. That's why my initial presentation was like 20 slides long. But then I started to delete things. How do I get rid of my wart? Anything that creates an immune response. If it's not better in 3 to 6 months, what are some of the home treatments? Oh, hey, maybe you've tried duct tape, other things like that. When do you remove it? I say if there's one wart, I would remove it. I talk about combination therapy. This is what I do now. I say, so this is the way I explain it. So I say combination therapy. So I'm always using, why combination? Combination would be like an Aldera, right, or a 5FU. Okay, the reason I do that is because you get the level 4 office visit for medication management in every single one of those. And then that's why that's the combination. And then if they do, the main way I explain Swift is I say, well, if you want to do like 3 or 4 visits, you do the Swift. A lot of times Cantharidin or salicylic, it can take 8, 9, or 10 visits. And that's the only thing I say about Swift. I don't say how much it hurts and stuff like that. Because Cantharidin hurts after. We have laser, we have Cantharidin, I have all these things. But that's how that, and I put Swift 3 to 4 visits, laser 8 to 10 visits. That's all. And everyone says, give me the 3 to 4 visit thing. That's what they say. And I say, okay, you can pay at $250 a session or get 10% off if you pay all 4. So everyone pays all 4 and they come back once a month. So that's, and then I go, this is all since adding Swift. So I just added a couple of slides you can see. Then I go to the next slide. It speeds up the cure by 50%, and it's 85% effective with less than 1% recurrence. This is just their literature that they put on there. I put here how it works, pictures, and then this is my treatment evaluator. This is on every single slide I have this, and I put this, I have a Achilles tendonitis treatment evaluator. I have a plantar fasciitis treatment evaluator. It's just something that I put up top. It says most effective. On the bottom it says least effective. And then I put things like effectiveness, comfort rate, complication rate. Swift is on top, Cantharidin, laser, Carac, Aldera, salicylic acid. That's the way I do it. And then this is what the wart treatment sheet looks like right there. Now, after that, I always put a black slide, so that's where I know when I'm done. But the cool thing with Google Slides, if they click any of these things, it'll push them to like slide number 46. And slide number 46 is going to go more in depth about Swift or Cantharidin or anything else. So it pushes to future slides if I want to kind of like go over about an AFO with a patient or an orthotic with a patient or something else like that. Okay? Any questions on how I set up the patient presentations? I do them in Google Slides. When I put them, if you get my patient presentations, they're going to pull up full screen. The reason they pull up full screen is when you do patient Google Slides, you can publish to the web. You go in, there's like a how to do something, you publish to the web. The reason I do that because it takes me 3 seconds to hit full screen, and I don't like doing that 30 times a day. So I click that in full screen, and it also makes it so people can't steal my slides. So you can do like you can capture it, but you can't steal my slides. Okay. So if you're interested, you can let me know. I can show you how you can get them.
So so this is pretty much patient education.
Yes,
right?
that's all it is.
You're doing this
In the treatment room. In the treatment room.
So you make the diagnosis, you do the physical exam, and
then I pull up my slides.
Verbal communication.
Yes. Yes.
This is a work. This is how I'm going to treat it.
Yep.
And you found this to be successful in achieving what goals for you?
Correct. So I can do much more Swift, much more Shockwave. I have a high, like 50% cash pay practice. So I'm better. I think you're better with visual, right? No patient has ever had. They come in and they say, "I've never had a doctor be so thorough with me." Now, also, how many times, if you're running 30 minutes behind, what type of presentation do you give for plantar fasciitis? You give them the 3-minute presentation with the cortisone injection, right? And if you have 20 minutes or it's a referring doctor, you're going to give them the 20-minute presentation. So this makes it much more objective. They're going to get the same presentation every time. They're going to get the recording of the video every time. And I'm much more, because I record this, okay?
So you record yourself explaining this.
Yeah, but that's the next step. Yeah, so you take this, you put it in Zoom, you click record, and you walk yourself through it, and you put it on YouTube, and you put it on your website, you give it to them afterwards. Like there's a way of, because they're not going to, I go through this, how much are they going to remember in a day? Nothing. Right. That's why I give them the video afterwards. It's all customer service. It's all like, they're going to be wowed by this.
Who sends them the link?
So on this piece of paper, there's a QR code that is a link to my blog, which says a video and a whole written explanation of this. My scribe is the one that texts it to them as well. I have Patient Education Genius, so these same QR code links, which are my blog links, he sends them via Patient Education Genius to the patient automatically as well. That's my scribe. He does that, my virtual scribe. So this is the example of a ward treatment sheet. They're all really the same. You could probably make one better, but this is what's working for me. I put the diagnosis, next appointment, what ward treatment we're going to choose, what prescription they're going to get, additional treatments. If anyone in your household has similar complaints, they should be evaluated. It's just so I don't forget to say that. Here's the home video. We have a texting number. They can text to pictures. And if I say, if the wart returns in the same location, it was never really gone. If it returns in a new location, it's a new one. Swift speeds up the healing by 50%. And that's what I do. And I just give them this one page. Okay. My staff has it ready in the treatment room. When I get there, they know it's the Shockwave 3rd visit. They know it's the Swift. They'll just put that in there for me, or I'll print it out. Next one for plantar fasciitis, which we see all the time. There's not many slides here. I tend to ask, how long have you had your symptoms? What treatments have you tried? How does it impact your life? Why do you want treatment? I talk a little bit about the anatomy. This one slide with a picture of the ultrasound is why every single one of my patients gets an ultrasound. It's this one slide. In Massachusetts, insurance doesn't cover it, so they all pay cash. And so what I say is, Mrs. Jones, we're going to start treatment today, so they're all meloxicam versus Advil. Why? So you can get to the level 4 visit after the first one, right? They're all getting they all get this stuff, okay? So they're going to get, a stretching splint, night splint. They're going to be getting stretch. They're going to get foam rolling, which I do in my office. I teach them how to do that. My morning stretch thing, like we all do. They're anti-inflammatory. And then Mrs. Jones, when you come back in 3 weeks, if it's not getting better, I'm going to do an ultrasound at that time. Is that okay? And that signals to my scribe to say, next visit, schedule an ultrasound. And they all do the ultrasound. Why? Because ultrasound is the only thing, in my opinion, that sells Shockwave. I ultrasound the right foot, split the screen, ultrasound the left foot, and they're like, wow, what a difference. There's an effusion, or I don't say effusion, there's swelling on that. Look at how thick that thing is. What you need is Shockwave. That's how they all get Shockwave, and then I check the little box. So this is how I do plantar fasciitis. The same way, this is the same treatment sheet. Now I have a little thing for musculoskeletal. It's actually a prescription pad in my pocket that I do for all musculoskeletal. So peroneal tendinitis, posterior tibial tendinitis, plantar fasciitis, Achilles, midfoot arthritis, because it's all really kind of treated the same categories in my opinion. The categories are repair and heal, shockwave, amnio, reduce inflammation, reduce tightness, reduce stress and strain. And it's all kind of the same, so that's why I have one that I have in my pocket that I carry with me. My only word to you, if you're going to make those, I printed out like, I don't know, $500 worth, and then I made an error on it, and I'm like stuck with like 300 of these. So if you want one, just let me know. I'll send it to you. It has my name on it, though. So this is the treatment sheet that they get. So if you get a new treatment and you don't do shockwave, you would just delete the shockwave from it. If you add shockwave, you would just add it to that. You would add it to the slides, and you just start presenting to patients. And what happens after you present it 3 or 4 times, you kind of make mistakes and you're not in such a rush, and it slows you down, and it triggers you to ask about other things. Like how many times when I go over this one right here and it has like a walking boot, they look at that slide, because at the follow-up visit, the only slide I pull up is this one. I don't go through the whole presentation the second time. I just pull up this slide. And they say, Doc, you never tried that walking boot. Well, I'll get you a walking boot. Or, what's that AFO thing? Oh, yeah, that's a brace that we have for it, right? So this is how, and they ask me about things now because I have this little slide, and it's a real simple slide. So that's how I do it. I don't know, it might work for some of you guys. This is how I do nail fungus. Same thing, you can see a similar format. And once again, I'm not good at design. I just paid someone on Fiverr, go to Fiverr, send them black and white slide deck, or steal mine, it's fine. And then they'll design it for you. Questions, what's the goal of your nail? Do you have fungus? Talk about the pathology report, treatment options, oral, nasal, topical, additional factors, talk about biotin, UV light, shoe spray, oral medication. This is how I do it. Now, I put this thing in here. It says patients with chronic or active liver disease should not be treated with terbinafine. Baseline transaminases are recommended. The FDA subsequently removed LFT monitoring recommendations from terbinafine. So I put that in there because we get that question like 500 times. And that's why I put that in there. And so it just kind of, any questions they constantly ask you, you just add a slide for it. That's the elegant thing about using these slides. You just make a slide for it. Now this is I think it's a good idea, okay? If you're going to do one treatment sheet that I use is this one. Okay, I don't use it for everyone. I want to be very clear. Sometimes I don't have times. Like you said, I'm not doing the slides all the time for everyone. I think in the beginning it's good practice. But let me explain this. It helps me. That's why all my patients get the UV light and the shoe spray. I don't know if you have a lot of hard time. I just get that UV light. Well, why do I need the UV light? They don't understand. So let me explain. Okay. So the first visit, they're all getting a nail sample. I don't give them the first visit. They don't get this the first visit. They come back for the second visit. This is waiting for me when I'm going to go over the nail sample. Nail sample is positive. At the second visit, I just check the boxes. I reviewed the results with you, Mrs. Jones. We're going to get an LFT. You're going to go to Quest. Here are the 2 labs. One's in Worcester, one's in Westboro. We're going to give you the oral antifungal treatment. You're going to get the biotin. This is the one that they sell. You're going to get 2 bottles of this. This will last for the next 3 months, so everyone gets the 2 bottles. This is just the way I do it. I don't know how everyone else does it, but at the 3 months, I find that 3 months isn't enough. I tend to have to give them a little bit more, so I give them a booster dose at that time. And then I always say, I don't know if you've heard of, if you're into like sales, I kind of am, there's something called anchoring. So I say, we could do laser, but it's like $1,500. So with anchoring, like you talk about I don't want $1,500. I don't want the laser. No, you don't need the laser. But I've mentioned that so that then I come up here. If anyone has similar complaints, it'll take 12 months because they always wonder how long it's going to take. Then I say, to prevent recurrence, because there's a high recurrence rate, you're going to get the UV light. You're going to use it once a month. And I explain exactly how to do it. Antifungal shoe spray once a week. You're going to wash your towels, alternate your shoes, disinfect your shower. Here's the process. Here's the QR code. And if you do it all today, you'll get 10% discount. It's about $200. Because that's all it is for those pills, the UV light and the shoe spray. And everyone gets that. No one doesn't get it. It's not that much. It's $200. Like my shockwave is $250. So it's like.
How much are you charging for your UV light?
I don't know. It's It's all about $200. So I think the 2 bottles are maybe like $40, and the UV light's like $120. And then what's the other? The spray is like 15 or 20. I just give them the process. So they take it, the medication once a day. They're going to get it at the pharmacy. They're doing the biotin thingy. I don't say it that way to the patients, just for you. They're getting the shoe spray, and then they're getting the UV light. That's how they get the whole like package.
What's the UV light?
One of these UV lights. It's so let me explain. The reason I don't put the name of the UV light is because the brands always change. It could be the Steri shoe, it could be the shoe zap. So explain as I explain it to the patients, okay? So once a week, you're going to be using the shoe spray because there's a warm, moist environment, and that's what breeds fungus, and that's what breeds the odor. And once a month, you're going to put this light in here, and just the same way when you look at mold on a tree, it's on the dark side of the tree, so we're going to put this in your shoe. It's got a UV light that's going to kill all the fungus inside of there, and that's why they're going to do it, okay?
You're dispensing the medication?
No.
Oh.
They go to the pharmacy for that.
Oh, sorry.
The biotin.
Oh, yeah, the biotin they buy. Yeah, this is the one. And I say it's not, no. No one ever goes to Amazon for anything. So biotin, mine has zinc and iron, and you need 2,500 micrograms. Doctor, I'm already on it. Well, if you take too much, it's no big deal. This is the one that you need, okay? And I know it's one of the, I think this is the one that have the Baco one, whatever that one is. There's different biotins that you can do. And so I kind of merged 3 different companies together, and this is kind of what we offer. If I offered something else, I would just change the presentation. I would change the slides. Okay? This is the one I have in my pocket. This is the one that I use more often. I call it the foot treatment sheet. It's got my little logo. I write down the diagnosis when I'm going to see him back. And what I say is I'm going to check what we're going to do today, and I'm going to circle what we might do next time. So next time we might do ultrasound, and we might do shockwave. Okay? That's how I do it. So when they come back, no one ever brings us back. Okay? But this is how I explain it to them. And I'm just doing this right in the treatment room with the patient. This is the next visit. I did an ultrasound for you today, Mrs. Jones, and that's what determines shockwave all day long for me is the ultrasound. Then they're going to get shockwave 3 sessions. They're going to continue to do this other stuff, and then we're going to do physical therapy at the end of your shockwave. Well, the way I do it is so they come back for the shockwave. They're going to get 3 sessions. At the last shockwave, I actually have a piece of paper. If you look at my treatment sheets, you can get those. I have a last shockwave piece of paper with check boxes. You know why I do that? So I can get a level 3 office visit at the last shockwave visit. Okay, so I'm always trying to orchestrate ways that I can do office visits and really be comprehensive, and they can see that. You can also learn from YouTube videos and others, act fast, try to simplify. Orchestration, so develop a consistent experience because patients talk to one another. Everyone gets the Pelto special. You want to know what the Pelto special is? Okay, the Pelto special, my staff knows. It used to be called the Saviet, who was my partner, Ben Saviet, and I didn't like saying his name all day long, so I just changed it to the Pelto special. So it means every patient, they get a morning stretch, they get foam rolling on the back of the calf, and they're going to be getting either 1 or 2 night splints. So if it's unilateral or bilateral, they can get bilateral night splints. And my staff teaches them that, and all of it is followed up in that page that I send them. And then I use staff to do this. So how to implement this? All this stuff is on my website and my blog, and I refer back to the blog. Put it on your website, send it to them. Like, how great would it be is if a doctor sent you that video before with how I'm going to treat them? That's great. Why don't you send it them? If they make an appointment, you could go on patient education and send them that stuff on plantar fasciitis so they know what to expect when they come in. Those are my favorite patients, the ones that have already seen the stuff. I have a welcome packet, stuff like that. Show them during the visit. I tried to use the iPad, didn't quite work for me. Share the slides, and then send it out to them after with a video recording. We've done webinars with the same presentations to all of our patients, so sometimes they send out the webinar, place it in QR codes and on the treatment sheets. So all of this can be found on patientpresentations.com. You'll get a copy of my treatment slides, and the treatment sheets are in there. If you have anything, you can just reach out to me at Podiatry Practice Mastery. This is kind of what I like to do for a hobby. There's a podcast. You could join the podcast if you want on iTunes.
Just because I'm old, and you said it many times, and I didn't. Fiverr?
Yeah. So I'm sorry. Fiverr is a virtual assistant company. So you go there, and it's called Fiverr because you used to pay $5 for each little gig that they did for you, but nothing's $5 anymore. So, but you could just get a virtual assistant to do it. So get someone else to do it. The nice thing about Fiverr is they have specific tasks that you're paying for. Like they did.
Know what you're saying? I'm sorry.
Yeah, huh?
F-I-V-E-R, Fiverr.
F-I-V-E.
Fiverr.
F-I-V-E-R-R. The main difference between Fiverr and a regular virtual assistants, they can do everything, and you tend to have them, monthly or whatever. Fiverr does one task. Like they developed my treatment sheet paper. I'm like, I want this treatment sheet. I don't know what it looks like. I don't know how to design it. Can you do it? And they charge you $10. They video edit. They do intros for me. They do anything that you hate doing. Look up Fiverr, and you can write the word in there, and you can find someone for like $20 that'll do it. And they're really much better than we are.
So I've used them for professional engineers who need a map for my clinic for the fire marshal. When the architect said $7,000, they did it for $80,000, and it was a PE. I'm working with a geneticist right now for a potential disease I'm trying to find. And so you can find all kinds of people. Not just, I love Fiverr, so I wanted to make a comment.
Yeah.
But I use them for editing everything as well. But
You know, like graphics, so like for your graphics.
Yeah, graphic design, making thumbnails, editing videos. You can go, like what I would recommend, if you take the presentations that you have or steal mine, pull them up, open up Zoom, hit record on the cloud. It's kind of getting high-techy, but record on the cloud. Send them a cloud link to Fiverr and just have them download it, edit it, cut it up, use it put it on your website. They can do all that stuff for you. Like, we don't need to know how to do that. You just need to know who. There's a good book called Who, Not How. Who, Not How.
So do you only do one recording per pathology?
Yeah.
Per diagnosis?
Yeah.
Or do you record every session you have with the patient?
No,
Okay,
I do it. And when you're learning it, I think it's good to record ourselves because it humbles us.
Absolutely.
But I have one recording for every single pathology that I have until I change the protocol. Then I make another recording and put up the video.
I'll get that.
We have 4 doctors. We have a lot of staff. Yeah, and a virtual assistant that's with me. It took a long time. I've been doing it like 15 years, and what really got us there was shockwave. Some days I do 6 or 7 shockwave. I do a lot of shockwave. So yeah, so does Ben. Ben Saviat, my partner, he's a young kid, and he's like, Don, we got to get this. I'm like, it's too expensive, and so I couldn't live without shockwave now. Okay. Huh? Oh boy, I have the focused and the radial, so we use Curamedics. There's a conference coming up in December. I've been 3 times. And if you're going to buy this technology, by the way, go to the conferences. It's no use to buy the technology and don't go there. Do a deep dive. You go to their website, and during the pandemic, I just did a deep dive in all their reports and everything that they did. You have to geek out on it. Come visit my office. I'd love to have you. I do it for everything, except ED, everything.